welcome to our viewers on Globespan 24/7 as we bring you back our Monday night program. We want to apologize last week. We had some technical problems, so we could not have been on the air. So there's a rebroadcast on one of our programs with Attorney General Anil Nandalal. Today we're back live, and we want to thank Nohar Singh for making this platform available. Of course, Devin Bisu, our technical specialist. Today, it is no stranger to us, as for those of us who follow the stars and the moon and the sun, today is what is called the harvest moon. It is the harvest moon because it is come to the lowest towards Earth in the autumn and in the spring. And for those of you who can look at the moon tonight, you will see a very big, bright, beautiful moon. And I think Guyana, by now, you should be able to see it there. Here in New York, we'll have to wait maybe an hour or so, and then we'll see the moon here. But welcome to all of you, and we're very honored this evening to have for us the second time since becoming Minister of Health, a very challenging task, I must say. And Dr. Anthony, we want to welcome you this evening to our program, as there's lots of questions in the health sector, and we hope that we can have a very good dialogue this evening. So the Honorable Frank Anthony, welcome, sir.
Well, thank you so much for having me on your program, and I would like to also join with you and thank Mr. Nohar Singh for maintaining this program and giving a perspective for an avenue for Guyanese, both at home here and in the diaspora.
Thank you, Minister. And Dr. Rose, as well, as usual, welcome to our program, my co-host.
Thank you, Charles, and welcome to all our listeners. And thanks again to Nohar Singh and Devin Bisoon, our technical director. And to you, Minister Anthony, thanks for being on the program for the second time. Thanks a lot.
And as we speak tonight, I'm sure all of Guyana and those in the diaspora would know that His Excellency the President is in New York for the UN General Assembly. I was tracking on social media today. He had a very busy day, meeting with the pastors out of Brooklyn, and then he went and lay a wreath at the 9/11 monument in the city. So the president is very busy. With him is the vice president, Dr. Barjak there, and Foreign Minister, Minister Hugh Todd, among others. And I'm told that Minister Anthony is also acting our foreign minister. So, Minister, how is it challenging to be Minister of Health and the Foreign Minister acting?
Well, it's the usual thing in terms of the portfolio. In terms of health, I'm quite busy. I have a lot on my plate right now. But, if I can help out Minister Todd when he's not here, that's fine as well.
And you have a very broad shoulder. Health is very challenging, Minister, as you know, and you have all the ministries have difficult tasks, but I think in your ministry, your task is even greater because your ministry deals with the health of the country. So, Minister, in beginning the program tonight, can you tell us some of the development that took place in your ministry and what is going on as we speak after 1 year in office?
Well, thank you so much. I think we have a number of things that we can point to. First of all, we've been looking at how we can develop the infrastructure within the health sector. And I had the privilege of working with the UK government. They are funding several projects in the health sector here. The first one has to do with the rehabilitation of the Diamond Hospital in the East Bank. And we have completed that renovation of that particular hospital, and it's back now in operation. What we tried to do there was to create what is called a smart hospital, meaning that the flow within the hospital is now quite different. It flows seamlessly. And also to make sure that we are using more renewable energy at the facility. And we also want to make sure that it's not flooded, or when it rains, it does not become flooded. So based on these principles, we've been able to complete Diamond. By the end of this month, we should finish Lenora and have that back in operation. And we are also currently finishing off a project in Mabaruma Hospital and in Lethem. So within another month or so, we should finish all of these projects, and they're all being done under these principles of SMART, making sure that they're climate resilient and that we are using renewable energy. In addition to that, there's one more that we are now starting, which would be the Paramakatoy Health Center. And we will be spending about $800,000 to renovate that particular health center. Outside of this particular project, which is funded by the UK government, we also have a project that is funded by the Indian government. And that project is looking specifically at the West MRR Hospital, the Suddy Hospital, and Bartika Hospital. So we have the consultants, the Indian consultants came down to Guyana about 3-4 weeks ago, and they're now completing their designs. So once those designs are completed, we'll then be able to go out to tender and to get someone to construct those hospitals. We think that we need to modernize the infrastructure for these facilities and to, of course, add new equipment. So in this modernization project, what you'll see is that at regional hospitals, we'll now be able to have a whole suite of imaging facilities, including not just x-rays, but CT scans and MRIs and stuff like that. We want to do a new laboratory, and so that would be part of the arrangements. And of course, for all of these hospitals, you will see new theaters, more theaters, and of course, inpatient facilities. So the construction for these three, we are hoping that we can start them sometime mid next year. And that would go for another 18 months or so when whoever win the bid would have to complete the projects. With Government of Guyana funding, we have been able to renovate or in the process of renovating at least about 40 different health centers to create waiting spaces and to enhance the general facilities at these health centers. And as you know, we do have a number of district hospitals, but many of the district hospitals in the interior, they were not able to do surgeries. So right now I have a project in Region 9 at Sand Creek, where we are now adding to that district hospital a small theater. So basic surgeries would be able, we would be able to perform them there. We're doing a similar thing in Region 1 in the Maruka area, where we have added, or we are in the process of adding a surgical theater. We are doing similarly in Madhya, a similar project. And all of this is intended to add the new services that never existed there before. Because we do have doctors that are going out with surgical skills, but they have no place to perform the surgeries. In addition to all of this, we have also been looking at maternal and child health. And what we found in some of the interior areas, it would be good to construct waiting homes. So if someone who is living in a remote village, they can come to the waiting home next to the hospital, be there for a couple of days. They deliver their baby in the hospital, and then they wait for a couple of days to make sure everything is okay, and then they go back to their village. So we have commissioned a 14-bed waiting home in Lethem. That's operational. And we are going to do this in some of the other regions. The waiting homes are at different stages of completion. Hoping by the end of the year, we'll at least have 2 or 3 more in operation. So that's on the infrastructure side. We have also been working on reduction of malaria. And we have been distributing insecticide impregnated bed nets, especially in the interior communities. We have completed the distribution of close to about 60,000 bed nets to these communities, where we literally have healthcare workers going out to the different villages and going home to home, handing out these bed nets to people. We feel that by using this technique, that we will see a reduction in malaria cases. In other countries where this was done, we have seen those reductions. So we are hoping here that we can see reductions in our malaria cases. We have also been going out to the mining camps and doing a similar thing. And we have not just bed nets, but we have hammock nets as well, where you get the hammock and you get a net with the hammock. And that has been very popular with the miners, so we'll continue working on that. And earlier this year, we also did the administration of drugs, mass drugs, 3 drugs, to reduce the prevalence of filaria. And we have successfully completed that project. And now we are waiting on the Pan American Health Organization to do a validation of what was done in all the different endemic areas for filaria. That validation would be completed by the end of the year. And then every year subsequently, we'll have to do some random checks to see whether filaria still exists in Guyana. And if it does, well, then we'll have to do some additional treatments. But I think this is just one example of how we have been battling with filaria for so long. And now we are on the verge of eliminating this as a disease in Guyana. We have also looked at other infectious diseases. This include leishmaniasis, trypanosomosis cruzi, and some others. And we feel that over the next 3 to 4 years, with the right techniques and right treatment, that we'll be able to eliminate some of these other diseases from Guyana as well. So it has been an active year where we have focused on some of these types of issues, as well as COVID and the chronic non-communicable diseases. But maybe I'll stop there for now.
Yeah, Minister, you have given a litany of achievement in the short time that you're back in government. And I presume some of these, what you have discussed, had started even prior to the last PP government, continue with the coalition, and now we continue again. So there's some continuity with whoever was minister and the Ministry of Health at that time. Minister, for our audience edification, can you tell us how many health centers we have in Guyana, how many primary hospitals we have, and how many secondary hospitals we might have? And again, I'm glad you mentioned for the first time we have these homes where, you know, prenatal mothers can go and be there before they deliver the baby and so on. That's a new arrangement in Guyana. So can you tell us what is the process for the average Guyanese? You're sick, you have a headache, you have some stomach issue, whatever it is. What should the person do in terms of going to a health center first, going to a primary hospital, going whatever it is? Can you tell us that flow of what should happen?
So basically our system, we have 5 tiers. The lowest tier would be a health post. And a health post is generally staffed by a community health worker. So these you will find in very remote villages. And then from a health post level, we go to a health center. And health centers are more widespread. And you will normally have at health centers nurses, sometimes medexes would visit, or in some cases, depending on the population, you would have a doctor that has been assigned to that health center. So a health center might have a full complement of staff, which include doctor, nurses, and other allied type of health worker, in some cases like a pharmacy aid and so forth. From the health center level, we then go to the next level, which would be a district hospital. We have about 22 district hospitals across the country, and these would be able to perform some basic services, such as in internal medicine. They would be able to treat cases like diabetes and hypertension and so forth. You also have a little bit of surgery that would happen at these district hospital. Some of them, it varies. Some of them would have imaging facilities that are available in the form of X-ray. And so these are the types of services that normally a district hospital would offer. We are now putting in theaters in many of these district hospitals so that we can do basic surgery if it's necessary. And we are trying to also put in at some of these hospitals telemedicine so that they can be in consultation with the guys at Georgetown Hospital for complicated cases. So from the district hospital, you then go up to regional hospitals, and we have 10 of those regional hospitals. Georgetown Hospital, while it's a tertiary facility, it also functions as the regional hospital for Region 4. And in this regard, the regional hospitals would have a wider scope of things that they can do, including the services that they're offering. Then we have the referral hospital, which in this case you have Georgetown Hospital being a referral hospital. So if there are cases that the different tier cannot solve, they're referred into Georgetown Hospital. Other specialized hospitals that we have would include the psychiatric hospital, which is at Fort Kanji. And, you know, in certain cases, we'll put patients at that tertiary facility. So these are the tiers. We have, I would say, probably about 300 or so health centers, and maybe another 100 or so health posts. And as I said, the health posts are more in the remote communities. We have introduced another layer that is called a polyclinic. And so a polyclinic is intended to have diagnostic facility and serve several health centers. So the first polyclinic that was introduced was 20 years ago at Enmore. And we probably would need to do more of that because they support a network of health centers. So that's a concept that we are also working on. One of the things that we'll be doing, and I've started this already, is to set up a specialized center for diabetes. So we have a diabetic center that is now under construction at Lusignan, and it would offer the full range of service. So apart from meeting someone who would tell you about your diabetes and so forth, you would be able to do your laboratory tests right there. You would be able to get counseling for the type of nutrition that you should be using. You would be able to do your eye tests. So all the services that a diabetic would need, you'll get at this center, including if you have to look after your foot. If there's an ulcer, they'll be able to fix it right there. If you need to get a prosthesis or a prosthetic shoe, you'll be able to get it at that center. So we estimate that we have probably about 60,000 or so diabetic patients. Some persons who know that they are diabetic, others who are still undiagnosed. And we think that if this concept works, then we'll put similar centers in other parts of the country. So there's a pilot that we are running. We expect that by sometime next year, this should be up and running, and then we'll be able to roll this out if it works very well. But in terms of the structure, those are the types of structures that we have in place.
Thank you, Minister. And I think one of the problems we do have in Guyana is the education of our people to know where to go to when they have a problem. So everyone goes to the Georgetown Hospital when they could have gone to the clinic or to the health center or to the regional hospital and so on. So I think the attitude need to change, but that comes through education. How much effort is your ministry putting to educating the public of what should happen? Should something happen to them, where should they go to?
So generally, the health centers, they operate more during the day. So they're basically from 8 to 4. The hospitals, that's the district hospitals, would be a 24-hour service. So district, regional hospitals, tertiary hospitals, that's a 24-hour service. So if it's a problem that you have during the day, you can go to your nearest health center and be able to get service. If it's a problem that, like late in the night after hours, then you'll have to make your way to one of those district or regional hospitals where you can get service. So it just depends on the timing, and that's something for people to bear in mind. We do see that a lot of people with chronic illnesses who can be served right in their community, they sometimes bypass that health center and they go to the other level, maybe at a district hospital or a regional hospital. And we have been, when we see them at the regional hospital, try to send them back to their local health center where they can be properly managed. But it is a problem, and we have to keep working on it. I guess it's people feel they get better service if they go to the hospital. We'll have to make sure that the quality of service at the health center is it's at a high standard so that people would feel comfortable accessing the health center and getting the service closer to home.
Thank you, Minister. And I guess my recommendation would be one of the things that you can do, your ministry, is have the village give an evaluation of their health centers. So at least that feedback coming to your ministry, you will know exactly how they perform and what needs to be done to upgrade the service. That's a recommendation maybe you can look at.
Yeah, that's a good recommendation. And in many of the health centers, what we have been working on is to get people from the community to form a health center management committee. So because of the people from the area being involved in the management of the center, that also helps. Yeah. And we're doing a similar thing with the hospital.
Thank you. Dr. Rose? Dr. Rose, you got to unmute yourself. You're muted. Dr. Rose, you're muted. Unmute yourself. No, you're on mute. Yeah, that's fine. You're okay there now. No. Yeah, that's it.
Yes, Dr. Anthony, as I said, welcome to Globespan again. And this is your second time. Now, since you took over the Ministry of Health, tell us the condition you found the ministry in. My colleague Charles mentioned this. And what steps have you taken to rectify the situation that you found it if it was not appropriate to serve the people?
Well, that probably would take us all night, Dr. Rose.
No, make it short.
Well, I think the biggest challenge that we had when we came in, apart from all the other things that we just spoke about, infrastructure and personnel and all that, I think the immediate challenge that we had was to make sure that we had facilities to manage COVID-19. Many of those facilities were lacking. We didn't have enough ventilators, space for patients, and all of that. So that was an immediate challenge that we had to work on. In addition to that, we also at the time had a major drug shortage where we were not getting pharmaceuticals. A lot of the stuff that we had in the bond were expired, and so there were chronic drug shortage across the system. So I would say as priorities, these were two of our top priority. We had other priorities, but these two were among the utmost that we had to work on immediately. In terms of medicines, we have been able to procure enough medicines now that we have very few items that are short. And we have been distributing that to the regions, and the regions getting it out to the various health centers and so forth. So I think while it might not be perfect, we have come a long way over the last year in terms of addressing drug shortages and shortages of supplies. And in terms of making sure that we are ready for COVID, as you would recall, we were able to fix the Ocean View facility. And I recall coming in August, and we had no equipment, a lot of stuff, no electricity, water, nothing at that place. And we had to fix that because our first patient actually entered that facility in early September. I think on the 1st of September, we had our first patients going in there. So that took a lot of energy to get it up and running. And even as I speak to you now, you would know that we have what is called a Delta surge, meaning cases that are caused by the Delta variant. So we are seeing a lot more cases, and we are seeing a lot more hospitalizations. And of course, with hospitalizations, we are going to see deaths. And over the last week or so, on a daily basis, we're seeing probably about 200 new cases, and our hospitalization rates have gone up. We now have close to 150 persons in hospitals. In fact, yesterday we had 173 persons who are now in hospitals, with 30 in the ICU. So that has been a challenge for us, and it's going to be going to continue to be a challenge going forward over the next couple of weeks.
Dr. Anthony, sorry. What concrete steps have you taken to deal with the Delta variant in the COVID pandemic crisis? Because as you said, cases are amounting to almost 200 per day. So what steps have you taken different from fighting the COVID virus of itself today?
So several things. One is to get more people to comply with mask wearing. Two, to get businesses to put measures in place like mask wearing, sanitizing, and so forth. And I think the main one that we have been working on is to get people vaccinated. Because if you're fully vaccinated, meaning that you got 2 doses of the 2-dose vaccine, and 14 days thereafter, you would be considered to be fully vaccinated. So we have brought into the country 4 different vaccines for the adult population. And we have been administering these vaccines and working in every region to make sure that people can get vaccinated. As of yesterday, we've had about 346,529 persons who receive a first dose vaccine. That approximates to about 67.6% of our adult population here in Guyana. And of those who got a first dose, we had 179,115 persons who received the second dose of the vaccine. So that's about 34.9% of our adult population. We have, over the last 2 weeks or so, started to vaccinate children using the Pfizer vaccine. And these vaccines are we have been giving it for persons 12 years up to 18 years. And so far, we have administered about 20,636 doses, which would approximate to 28.3% of that age cohort. So vaccination, we have had some amount of hesitancy some amount of resistance, but nevertheless, we have to push through, because what we have noticed is that if you are fully vaccinated, then your chances of being hospitalized is significantly reduced, and your chances of even getting COVID is significantly reduced. Your chances of death significantly reduced. So our push is really to get more people fully vaccinated as quickly as possible.
Okay. Dr. Anthony, President Ali has said that he will not meet with the opposition leader because the opposition has not recognized the government so far. But we have a national health crisis on our hands in Guyana here, taking over 700 lives. Do you think the president should have put politics aside, ignore what APNU and its leaders are saying or doing, and meet with APNU and jointly administer a joint statement and calling on everyone to take the vaccine? Today, what we're seeing, frontline workers, nurses and teachers are reluctant or refuse to take the vaccine because they're saying the government actions are dictatorial. So do you think the government, President Ali, should have met with the opposition leader, Mr. Joe Armand, and they issue a joint statement urging people to take the vaccine and put politics aside?
Well, you know, we have been appealing to everyone, and we have done this several times in Parliament, appealing to everyone to make statements to encourage people to get vaccinated. Unfortunately, what I've seen is that while some of the leaders in the opposition might make some statement pertaining to vaccination, their actions is totally different. So one is that you make a pronouncement, but then you don't follow it up with the right actions. And I think that has caused confusion and hesitancy among the population. So we keep saying, and we keep encouraging everyone to come out and get the vaccine. I have spoken to many of those leaders in the opposition directly, asking them that they should make a very clear statement as it pertains to vaccination. But we have this mixed messaging, and that's not very helpful. So we need to keep talking to these leaders and hope that they would, make the right statements and back that up by their actions. Because other than that, unfortunately, if we continue to see this level of hesitancy, we are going to see more people getting sick. We are going to see more people going into the hospitals, and we are going to see more deaths. So, everybody needs to step up and do their part in terms of encouraging vaccination.
Do we have enough vaccine at hand for the whole population?
We have enough for the adult population, and the age cohort that we are dealing with right now in terms of children, we have enough. So every adult in Guyana who want to get vaccinated, we have a vaccine for you. So it's as simple as that. And we also have a number of vaccines that are in the pipeline that would be coming to Guyana, because our source of vaccines have been several. We received donations from India and China. We have received donations more recently from the United States. We also got vaccines from COVAX, and the government of Guyana would have purchased vaccines from the Russian Direct Investment Fund and also through the African Union. So we have enough vaccines for everyone who wants to take a vaccine.
When do you think we'll reach herd immunity?
That's a tough question. It's tough from this point of view because I think a lot of the experts now think that for you to get herd immunity with the Delta variant circulating, you're talking about 90% of your population being vaccinated. And with hesitancy, it's going to be very difficult to get to that 90%. Nevertheless, we have to try, and that's what we're working on.
Over to you, Charles.
Minister, as we're on the vaccine, I just want to pick up that a little. You mentioned that over 67% of the adult population had the first dose of the vaccine, and 35% had both doses. Can someone have a vaccine from Pfizer, the first one, and then a second one be from the Sputnik vaccine? Can that work, or it's not advisable?
Right now, most of the manufacturers they don't want you to interchange vaccines. So if you got an AstraZeneca first dose, they're advising that you should get your AstraZeneca second dose. In the case of those persons who receive a first dose AstraZeneca, we have enough AstraZeneca to give you your second dose. We also have Sinopharm. And Sinopharm vaccines, once you get a first dose, you should get a second dose Sinopharm. And again, we have enough Sinopharm vaccines that are available for that second dose. So that's not a problem. Where I think we have had an issue is that with the Sputnik V. Sputnik V is two different vaccines. Your first dose is one vaccine, which is made from an adenovirus 26. And the second dose is made from an adenovirus 5. So there have been a global shortage of the second dose. And that's because of challenges with the manufacturing process, because it's more difficult to do the second dose. So we have had those shortages as well, because it impacts everybody. And we are working very hard to resolve that. And I'm hoping that in this week, that we will be getting some additional doses of Sputnik V second dose, because there are people who are awaiting that second dose. So that's one challenge that we've had. But there are people, when I did the analysis, there are people who receive first dose AstraZeneca and first dose Sinopharm that has not come back to get their second dose. And we need those persons to come back and make sure that they complete the process. We have also started to use the J&J vaccine, but we have been using that more in very remote villages that are hard to reach. And when you go in, it's going to be hard to go back to. And because J&J is a one-dose vaccine, when we go in, if we administer it the first time, you don't have to go back again and look for that same person to give them a second dose. So places like in Region 8 and Region 7, we've started using the J&J in those hard-to-reach areas. And then with Pfizer, we have been using that for the children population. And so far, with 20,636 doses, first dose, I think that's a relatively good uptake, but we have to, in the coming weeks, we have to improve that. So that in this age cohort, we have 74,000 persons that we are aiming to get vaccinated. So we have enough Pfizer vaccine for this age group.
Okay, Minister, we want to continue discussion. Very interesting discussion. I'm sure it's very informative to our population there in Guyana, as well as, of course, those in the diaspora. But we'll take a short commercial break. When we come back, we'll continue the discussion. So don't go nowhere, dear audience. We'll be right back.
Thank you to all of our Travelspan and Amros Travels customers and staff. We are still operating after COVID shutdown thanks to all of your support. Our staff has made the best efforts during COVID to speak with the airlines on your behalf. They stayed on hold for hours sometimes with the airlines to rebook your reservations. We are happy to serve. Our offices are operating at 10809 Liberty Avenue, Richmond Hill, New York, And our Valpark office and GT offices are open as well. TravelSpan survived these 27 years with our customers, staff support, and God. In our 27 years, we are grateful to be here with you in the community. So call us today in New York at 718-845-0437. In Trinidad, call 645-1604. And in Georgetown, call 227-1701. And Rose Hall, call 337-4287. Folks, the Nest Restaurant is the place to dine for Guyanese and Caribbean dishes. It is the best restaurant in Queens. The staff is courteous, and Dave, the owner, is always there to welcome you. So for a memorable dining experience, visit the Nest Restaurant located at 12717 101 Avenue, South Richmond Hill. Go and make a reservation today or takeout. Call 718-847-4035. Get your meals delivered directly to your home. Order your curry duck curry, goat, or chicken, plus your Dalbury roti and bus-up shut from allfromonesupplier.com. We ship your meals directly to your home, so you can enjoy it upon arrival or refrigerate it and take it out when you're ready to eat. No more waiting in lines and no more losing time. Now you can treat yourself with a tasty curry and roti. You can also order solos, ices, pear jacks, coconut water, and much more from allfromonesupplier.com. It is free shipping to all U.S. states on all your curry duck curry, goat, and chicken, plus sodas and all West Indian items. So treat yourself or send a gift box of your favorite food, tasty pastries, sweets, and coconut water, or any West Indian item, products such as fish, meat, curry powders, pepper sauces, and much more from allfromonesupplier.com. Call today at 718-551-3292 or visit allfromonesupplier.com. Remember, it's free shipping throughout the U.S.
Welcome back to our program on Globespan 24/7. We have with us the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, before we went to break, we mentioned that 67% of the population had their first dose, but you said only 35% had their second dose. Is there a reason why those who took their first dose did not come back for the second dose? And you're on mute, Doc. You got to unmute yourself.
Well, part of the thing would be that the availability of the second dose Sputnik, because a lot of people here took the Sputnik vaccine. But that's only part of the reason. I think there are lots of people who took the AstraZeneca and Sinopharm, and we have to get them to come back and complete the process, because if they're partially vaccinated, they wouldn't get the benefits of the vaccine. So that's something that we have to talk to them about and to, help them to come back and get fully vaccinated. Our big problem would be that if you are not fully vaccinated, and this is being borne out by the numbers that we're seeing in some of the people who are dying. We have seen persons who are partially vaccinated can get severely sick, and in some instances can die from COVID. But we have less than 1% of persons who are fully vaccinated, and even with advanced age and comorbidities, just less than 1% of those persons have died once they're fully vaccinated. So it makes a big difference. And that message, we want that message to get out so that more and more people can weigh the options that they have before them.
Minister, you and your government have reached out to everyone. I've seen the ads, I've seen the daily newspaper reporting. And if someone don't want to take the vaccine, I mean, in my view, that's their own right. But they should be told by your government that if they get the virus and they're hospitalized without a vaccine, then the cost of care will be on them. And there's no guarantee that they will have the care. I mean, you're trying your best, and if someone don't want to take it, I don't think you should force them. That's my view. but there is consequences. So if they get the virus, the cost for the treatment will be billed to them. Is that something your ministry is considering?
Health in the public sector is free of cost. And we have been, despite all the challenges, we have been working to make sure that we can get the right medication, have enough oxygen, build capacity at the hospitals so that we can accommodate patients and so forth. But it is challenging. And I think sometimes the staff who are working with these patients, they get frustrated because you're seeing so many unvaccinated people who are coming in and they're getting the more severe form of COVID, which could have been avoided. But nevertheless, once they present and they are in respiratory distress, then obviously we'll have to work and give it our best shot. But it helps if they can get vaccinated.
What's the average? Yeah, what's the average cost for a person who got infected with the virus and if they go into ventilation?
I would say on average we are spending more than $5,000 per patient.
Per person.
Right.
That's
that's a lot of money because
that's $1 million Guyana.
Yes. In some cases, some of the person would require 15 liters of oxygen per minute. In other cases, they require 30 liters of oxygen per minute. And, you know, we got to buy the oxygen. So we have set up a big tank at the Ocean View facility that's being filled every 24 hours. But depending on the patient load, we might have to increase the frequency of how we are filling that. And then in the other regional hospitals, we have been using these gas tanks. And again, depending on the patient load, we have to get more of those. So right now, we have lots of, apart from patients being at Ocean View, we have patients in West Demerara Hospital. So we have 12 patients right now. We have another 12 patients in Maikoni.
With the COVID?
With COVID. We have 5 patients in New Amsterdam. We have 2 in Skeldon. We have 2 in Barkika. We have 2 in Madia. We have 3 in Wisma. So, I mean, in all these facilities, we have doctors that have been trained how to manage. We have put equipment. We have, you know, put all the requisite things that you need to manage a COVID patient. But unfortunately, if people are not heeding advice, we are going to see more cases. And this is avoidable. That's the big thing. It's avoidable because if people take the vaccine, we'll see less hospitalization. And,
but Minister, I want to do the devil's advocate now. And with the amount of information on the internet, some people are not satisfied that this vaccine will do exactly what it says it will do. Now, there's one side who argue that this vaccine might be the mark of the beast. You're a Christian. You know what the Bible talk about, the mark of the beast. With this forcing, without a vaccine, you cannot go to a gym. You cannot go to the bank now. You cannot go to a public building. You cannot do all these things. Eventually, you cannot buy food. I'm not saying this is a mark of the beast, but people have concerns. Should they be forced to take the vaccine if they have that belief, knowing the consequence is that you will die from it if you don't take it?
Look, we are not forcing anybody to take the vaccine. You have an option. If you don't take the vaccine, then you have to present a PCR. So it's up to you which one of the options you want to take. So that's one. But secondly, there are lots of myths that are circulating. And I think if people just take a pause and think it through, they would understand that these things are just myths and it has no basis in reality. So let's take that one that, you know, the vaccine is the mark of the beast. I don't know that there's anything in the vaccine that makes it into some mark of the beast. But what I know that this thing is going to protect you. and it's going to prevent you from getting sick, and it's going to prevent you from dying from COVID. And I think that is what is important. Some people early in the pandemic was saying that they don't want the vaccine because if you take the vaccine, you're going to turn into a monkey. Now, over 5 billion doses of vaccines have been administered. I haven't seen any case of somebody turn into a monkey, right? Another popular myth is that if you take the vaccine for the men, you're going to become impotent. And again, there haven't been any studies that demonstrate that if you take the vaccine that you're going to be impotent. On the contrary, I have seen studies that came out of the University of Miami that when you get COVID, that one of the consequences of COVID is that you can have different problems with impotency and so forth. And I think there were 2 or 3 studies that came out from the University of Miami. For women, one of the popular myths that are being peddled is that if you take the vaccine, it's going to make you infertile. And again, there's no scientific evidence to suggest that that is so. So a lot of things that are being peddled, the scientific community has answered them. And if you don't want to listen to me, that's fine. Go to the CDC website in the US and you'll find all of this information. It's there. Or go to the NIH website in the US, that's the National Institute of Health. You will find the information there as well. So a lot of these myths have been debunked. You can go on the World Health Organization website, and again, you will find information there that would debunk many of these popular things that are circulating. So, you know, we have to be careful. Somebody send some, you know, some WhatsApp message or a video that talks about some negative thing about the vaccine. We receive it, we look at it, you know, it's very scandalous or whatever, or shocking. And then without thinking, we send it off to a couple of friends, right? We got to start vetting what we are sending on and what we are passing on. And we got to be, you know, thinking through these things to see whether they're making sense or not. And I think once we start doing that, you know, we'll have a better reception for these vaccines that are around. Many of the questions that have been answered pertaining to these vaccines, you still have people repeating them. And sometimes it's very hard to try to argue or even try to educate someone who got very rigid views pertaining to vaccines, especially these COVID-19 vaccines. But nevertheless, we still have to try it.
Yeah, Dr. Rose want to ask a question.
Yes, Minister Anthony, you said that the health services in Guyana are free at the public hospitals. Then why not the PRC test being free? PCR test rather.
Oh, we do them, but if you want to make a choice between getting vaccinated or getting the PCR test, then that's your private thing. Go and get it in the private sector. But we do tests. A lot of the testing that is being done right now, I think for this month we have already completed close to 40,000 tests. So it is an expense that the state is bearing. And bearing in mind that a PCR test would cost between $15,000 to $20,000. So if you choose not to be vaccinated and you want to go and do your PCRs, well then by all means, please go ahead and do that. But I don't think the state should be bearing that cost for you.
Dr. Anthony, I want to turn to a question that a lot of people need answers for, medical malpractices in Guyana. What recourse is there for victims of medical malpractices? And what disciplinary measures are taken against doctors who perform such practices? Can people sue doctors, or can people sue the public hospital if something went wrong with their procedures?
Of course they can. In fact, the public hospital had, over the last couple of years, I would say, they had several cases that came before, that went to the court, and the hospital would have reached settlements with the people who were afflicted by those cases. So yes, the hospital has been sued before, and I think that would continue once there's some evidence of malpractice. So that's one. If a doctor commits some wrongdoing, then there's a process. The patient can go to the medical council website, or a relative of that patient can go to the medical council website, and they can then lodge a complaint. Once that complaint is lodged there, the medical council would then initiate a process of investigation. That investigation, they would review it. If they feel that it's not a case of medical malpractice or whatever, then they would probably reach out to the person and explain their views on the matter. In some cases, it would close there. In other cases, they would put the matter before a disciplinary committee, which is chaired by a judge. And they would go through all the motions of a hearing, give the victim a chance to come, or the relatives a chance to come, present their case. The doctor who is being accused would have to present his case, and then you go through that process. And at the end of it, one of the more severe things that can happen is that the doctor's license to practice medicine in Guyana can be revoked. If the person who is aggrieved does not feel that they've gotten justice through this process, they can go to the courts. They can do that even before this process begins. So you have two tracks that you can work on. One is through the medical council, and secondly, go to the courts.
Dr. Anthony, it has been reported time and time again in the newspapers or in the media that some doctors, and I say some doctors at the public hospitals, do not perform surgery on patients. Instead, they will steer those patients to their private practice to perform procedures there and charge them a huge amount of fees. Have you heard about this? And if so, what steps have been taken to prevent such happenings?
Well, they have. This is not a new, I would say, phenomena. We have had reports in the past pertaining to this, and we have to work to make sure that this is eliminated completely. If there are cases, patients need to complain to the authorities at the hospital so that it can be investigated and we can take action. Unless we get complaints, it's going to be hard to take any form of action. Now, while I say we got to get complaints, there are people who might be afraid to come forward too, to make those complaints. But my office is always open. You can complain at the ministry so that, you know, we can then investigate it at the level of the ministry to see what is going on in any particular hospital. But this is not a new thing. We have heard about this before, and even when I was in practice, we used to hear about these types of things as well.
Mental health, Dr. Anthony. I looked at 3 studies today. I don't know how accurate they are, but it came from reliable sources, saying that Guyana has a acute mental health population of about 40%. Acute mental health. Now, you know, mental health is a serious problem in Guyana. All over, you're seeing people suffering from mental health issues. Some reported, some not, most not being reported. what the government has done to help these people or to alleviate this sickness from people, especially the ones who are being reported?
I think there's a couple of things that we need to do. First of all, a mental health unit was set up in the ministry, and that unit is made up of psychiatrists, psychologists, and so forth. And their job is really to roll out a more comprehensive national program. As part of mental health, we do have a challenge with suicide, as you would know. Guyana has one of the highest rates of suicide in the world. And over the last, I would say, 20 years or so, we have been working to reduce those numbers. It has come down, but it is still a big problem because we still have a lot of people who are committing suicide. And one of the challenge there is to create networks where people can reach out to if they are having those thoughts of committing suicide. A lot of times, persons with depression go undiagnosed, and we need to build a more robust system where if people come to our primary care facilities, that we're able to detect depression, which is one of the precursors, if you like, for people committing suicide. So we, from a system point of view, we have to do more work at the primary care level to make sure that these matters are tackled in a more institutionalized, in a more systemic way. If we just try to do a vertical program, that's not going to work because we have attempted to do some of those verticalization, and it really hasn't solved the problem. So mental health got to be an integral component of what we are delivering at the primary healthcare level. And to do that, we'll have to teach our primary healthcare doctors, medics, nurses, to be able to address issues of mental health. And it's not only depression, but all the other forms of mental health. Suicide is another area that we have to really put in some extra work in to bring down those numbers. In addition to that, I think one of the invisible epidemics, if you like, in Guyana is substance abuse. And that ranges from alcohol abuse all the way up to these hard drugs that people are using. And I think in many of the communities across the country, you would find persons who have become drug addicts. And we need to come up with a better system of how we can identify these persons, work with them to rehabilitate them. And we just don't have enough programs to offer this type of rehabilitation. So that's an area that definitely we'll have to expand. Two of the better known programs would be the programs offered by the Salvation Army and Phoenix Recovery. But we need many more such programs because this is a growing problem. And I don't think we have enough information pertaining to how many people are affected by drugs. But we have to work on this. And this can be seen in this under the rubric of mental health as well.
Dr. Anthony, we spoke about suicide, but based on the figures this year, the suicide rate is likely to increase over last year's rate. But that aside, you said Guyana is the world's capital for suicide, but it's not Guyana really. Put it in specific terms. The quarantine is 9 out of 10 suicides occurred on the quarantine. So far in 2 months, July and August, there were 11 suicides on the quarantine. It shows that the programs implemented before, they're not actually working. I was told there's a hotline and someone can call. I'm asking every government official who involved in mental health suicide prevention to call a hotline. And if they get an answer, then something is really working, but I know they will not get an answer. That phone keeps on ringing, 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 and no one is answering it. So what steps are you getting ready or preparing to reduce suicide in Guyana, especially after quarantine? It calls for specific programs. It calls for intervention, not a telephone hotline that no one answers.
Scott, I agree with you. We have to come up with more innovative ways of how we can address this program. The key thing here is when somebody is in that vulnerable moment, they need somebody else to talk to. And for somebody else to counsel them through this and to get them away from that point where they'll commit suicide. And one program that we had many, many years ago, and I don't know what happened to it, but it's something that I thought worked well, was called Lifesavers. And I recall going into some of the areas like Blackbush Polder and so forth, and doing educational sessions with community leaders so that they can actually, if there's a need, that they can be that person to help with the counseling and so forth. And I think we need to return to creating these safe spaces and persons within the community that can assist and where people, if they have a problem, they can go there and talk to them and get counseling and so forth. So maybe we need to create that community mechanism. So that's on one side. And then on the other side too, we need to make access to the material that people use to commit suicide a little bit more difficult for them to get to. This includes the pesticides and herbicides that people are drinking, the poison that people drink. And there are requirements how to store these things and how to keep them away from persons. We don't get so much suicide that is caused by people shooting themselves or something like that. But what we do have is people drinking poison, which is the herbicides and the pesticides that are commonly available in many rural communities. In Sri Lanka, where they would have implemented a program to keep a lot of these things under lock and key, they would have seen a drastic reduction in cases of suicide. And some of those practices that we've seen in other parts of the world, we would probably have to implement them here or borrow them and see whether they are applicable to our situation. But I just want to say, in addition to those things that we need to do, next month we'll be launching a number of programs in collaboration with Columbia University. Columbia University, as you know, is a subcenter for WHO dealing with they're a center for WHO and mental health. And they are going to set up a subcenter here in Guyana. And we have a number of programs that we'll be implementing with some of their expertise and so forth. So part of this would have to do with studies that would be conducted under quarantine, but not just studies in for study's sake, but how we can then use the findings to do better programming and to change the outcome of what is happening.
Okay, Minister, a quick question. There's a shortage of nurses in Guyana. I'm looking at numbers here. It's telling me 350 nurses are needed now in Guyana to not only help fight this pandemic, but to provide services to the people. What do you intend to do about this shortage?
We have 3 nursing schools, one in Georgetown, one in Linden, one in New Amsterdam. But as fast as we put people out from these, we graduate people, 2 things are happening. Some of them, they work for a little bit and then they migrate, and others sometimes pay off their contractual obligations and they go into the private sector. I personally believe that we are not training enough. So for me, I think to tackle this problem, we have to improve the training of nurses, to do more nurses, probably to set up a more specialized institute where we can train at least 1,000 nurses every year. And I think we would have space for them in the health sector and to cater for those who are migrating. That's a proposition that we are actively examining right now, because I don't think with the current level of training that we would be able to cope with the deficiencies that we are having and the migration that we are having. So it's something that we'll have to do. We'll have to train more and probably to develop new faculty to make sure that the curriculum and so by which they're trained is, you know, what is required at this time.
As you know, nurses are not being paid well in Guyana, so something has to be done to increase their salary or wages in order to keep them here. But that aside, do you intend to include in your budget next year to train 1,000 new nurses per year?
We are looking at a program where we can increase. It mightn't be 1,000, but certainly we want to increase the volume of nurses being trained.
Okay. Charles, over to you.
Minister, I just want to follow up on that. I know when I was at the hospital more than 20 years ago, the CEO then, Mr. Michael Kahn, he had initiated a nursing assistant program and a nurse aide program. Is that still going on, or is that something that your ministry is looking to expand? Because if you don't have the qualified nurse, at least this nursing assistant and nurse aide can pick up the slack for the, you know, so that the qualified nurses can do their medication and so on for the patient.
That program is still on. They still have nursing aides and other ancillary kind of staff. So we have a number of them, a number of different categories of people that are trained by these programs, right? And they're shorter duration, so they come out and they perform specific functions. I also think when we look at our nursing programs, that there's scope to redevelop the program in many sense. And why I say that, because sometimes a nurse got to do more housekeeping functions when they can actually do more nursing. So we can find a different category of people who do those housekeeping things, like fixing the bed and that sort of stuff, right? And nurses can then take on more the nursing type of care. So all these different avenues, we have to look at them to see how we can better utilize the trained people that we have in the most optimum way. And those are things that we are looking at right now.
Minister, what I'm hearing from you is that we are looking at it, we are looking at it, we are looking at it. We got to get more specific and implement those decisions. For instance, you mentioned, as Dr. Rose mentioned, quarantine is the headquarters of suicide. You mentioned that Sri Lanka has a system where farmers are required to put this insecticide in lock and key. Why we have to look at it? Why is the law passed to implement that? So that it is done. And if that is reducing the suicide in Sri Lanka, it's possible it will reduce the suicide rate in Guyana. On the other side, you look at the rum shops we have in Guyana. The owner, of course, he wants to sell his rum. He don't care how drunk the person is. He will sell the rum. If the guy wants some more rum to drink, he will sell it. Why don't we put in a law that if the guy is intoxicated, it will be a crime for the owner of the shop to sell more rum to the guy? Tax the rum higher. I mean, of course, that will have an impact on the family. But if you put additional tax on the rum, that tax can come to help to take care of those who are suffering from. So there's a lot of things the ministry can do, but we have to put it in action. We just can't say we're going to do this or we're going to do that, Minister. I'm not attacking you, but I'm just saying that these are things we got to be specific on.
I'm very happy that you raised that, but you also have to understand, and you work in the system, you have to understand some of the constraints that we have. This is not normal times. I believe if we didn't have to deal with COVID and all the consequences and ramifications of COVID, that many of the other things that we are right now talking about, we would have been able to be far ahead of it. But again, we have to prioritize our priorities here. And in terms of those priorities, we have to look at the immediate one, which is dealing with patients dying from COVID and how many people are dying. And it's a limited pool of people that we have to do the work. So yes, I agree that we have to train more people. To find faculty and to train people, it requires a little bit more time, and we have to get new faculty. We have to expand these programs. So we are working on them, but as you know, I detect that we got to work faster, but we got to work within our means as well. So
yeah, Minister, and I know
as impatient as you are,
yeah,
we have limitations here too.
And I believe I've been looking at you for the last year at your ministry. I think you're doing a great job. But as I said, unless you set targets and timeline, your team behind you, they will just keep going the motion because ministers have not set a timeline to get this done. If you put in place some timelines, maybe that will speed up the process. Minister, I just want to get back quickly to the COVID, if you don't mind. There's some complaints about the hospital here with COVID for the quality of care that you've seen in the papers, people who die from the virus. I would like you to address that. And secondly, Trinidad only accept people who had the Pfizer vaccine, I believe, to go into the country. So you're part of CARICOM. If you had the Sputnik or you had any other vaccine, you cannot enter Trinidad. Are you looking to correct those situations?
So the first one that you raised, I have seen some complaints in the press pertaining to conditions, let's say conditions at the Ocean View Hospital. But again, from where I sit and from some of the people who have benefited from care at that hospital, there are many persons who have said to me that when they went there, that they got excellent care. Others I have seen in the newspaper where persons have complained, but there might be some specific things that they don't like, but we'll try our best to address them. I recall we had one patient there who had complaints of food, and the staff made sure that whatever those concerns were, that they were addressed. So I don't doubt from time to time there might be issues that pop up, but as far as we get them, we make sure that we address them. So that is an ongoing thing. Now, one of the other things that we keep hearing from people, when a relative come into Ocean View, they would like to be in contact with that person. And that's fine. But the problem is that the staff that we have, if each person that is in there, when that person come in, we normally ask them to give us who they want us to contact and who we should update, right? So they give us that contact. We would normally call that person every day, give them an update on the person's situation and so forth. But there are cases where if there are 5 or 6 family members, each one of them wants you to personally update them. And that's impossible for us to do. Because if you got 115 patients in there, and we have to call every single family member, it's going to be a hard thing for us to do. So that is something that is challenging for us, and I have received a number of complaints in that direction. But we have, as we have said, identify one family member that we can speak to. We'll get the information to that family member, and that family member can, disperse the information to the rest of the family. And sometimes the family member that get the information don't tell the others, right? And so they're left out of the loop, and then they blame us. But that's something that we have to keep working on. In terms of vaccines, we have been using, as I said, 5 different vaccines right now in Guyana: the AstraZeneca, Sinopharm, Sputnik V, J&J, and Pfizer. Each country in the region, they would have their own rules pertaining to who they allow in their country and who they exclude from their country. In the rest of the Caribbean, all those vaccines that I've spoken about is acceptable in those countries. And if Trinidad has an exemption, well, then that's for Trinidad to deal with.
Okay, so you're at your ministry level with the Minister of Health in Trinidad, there's no collaboration to say, well, hey guys, we are giving different vaccine, and our people, once they're fully vaccinated, should have access to your country if they choose to come to your country.
Well, those matters have been represented at the level of the heads of government.
Okay.
And you would have seen that about, I think, a week or two ago, there were a special emergency meeting to deal with COVID in the Caribbean. And prior to that, the heads have addressed these matters. So from time to time, these things are addressed. But at the end of the day, every country, they're a sovereign state, and they would make the rules that best suit, or at least what they think best suit the interests of their country.
Okay, Minister, I was told that the nursing school at Linden was closed. Is that so, or is it still operating?
The nursing school in Linden is operating. What had happened early in the year was that in Linden, we actually have close to 280 extra nurses at that hospital. And that's because the people who go to the school in Linden are predominantly from Region 10. And we had said in the past that we need to have people from the other regions being able to access schooling in Linden. And so we had temporarily stopped the program. We have adjusted the program to make sure that every other region can have access to it. And now that program is up and running, and it has been running for the past couple of months.
Okay, so that's not a problem there. Minister, I know we're coming into program time now, and there's a lot more questions to ask. But in terms of, there was a report earlier in your administration that there was a direct order, well, not order, but a sole source of drugs for a supplier out in the US. Are you aware of that in your ministry, that there was sole source of drugs for your ministry coming from the US?
I'm not sure what you're talking about, but
that there was a sole sourcing of drugs directly to a source from the US that was given by your ministry without going through the tendering process.
You got to be more specific. Everything that we do, if it's sole sourcing, then we still have to get approval. So we still have to go to the tender board to ask for sole sourcing of whatever product it is that we're trying to get. And in some instances, in an emergency, we probably would need to go and get sole sourcing, because in that way you would cut down on the time. But I don't know what specifics you're talking about. I'll need a
I
specific.
will. Maybe I'll send you a WhatsApp message on that one. But Minister, we're talking about expiring drugs. That has been a sore problem in Guyana for decades. Under the past PP administration, there were billions of dollars of drugs that were dumped because they expired. Recently, with the coalition, when you came into office, there was billions of dollars in drugs that had to be dumped because they expired. They're paid by taxpayers' money, yet, as Dr. Rose mentioned in the earlier program, there are many persons who go to the hospital, they're given their prescription to go to the private pharmacy to buy their drugs. How are we addressing that to ensure that the storage of the drugs is as such that the doctors and the pharmacy know that these drugs are in the bond and they can retrieve them and bring it to the hospital so they can dispense it to the patient?
Well, we got to make sure that the hospitals and health centers that we have adequate supplies. So that's to start with. But also we have to do constant review of the formulary. Because if you have a formulary that is outdated and the doctors are not using the drugs that you are buying, then you will have a lot of expired drugs. So let's say the new protocol, say to treat hypertension has changed, and we are using drug A, B, and C, but we are buying drug D. Then nobody is going to use it. It's going to remain there and it's going to expire. So we have to constantly make sure that whatever the new protocols are, that the two things are in sync, and that we are not buying things that people are not going to use or people are not going to be prescribing. So that's an ongoing effort that we have to make, and we have set up a new therapeutic committee that is trying to make sure that these things are in sync. So that's one of the reasons why you would have expired drugs if it's not being used. The other one, of course, is that you have to make sure that you have the drugs at the level where people are prescribing it. And it's got to be constantly there. So one of the old system would have been that every month or every 3 months, you make an order. And whatever goes nil during that period of time, you got to wait for 3 months before you can order. What I'm trying to get implemented, and we have spoken to all the regions about this, don't wait until the 3 months. If you have something that is short, you just come and order it. And once we have it, we'll send it to you. So you don't have to wait for 3 months. Once it's there, order it and get it, and make sure that you're fixing the problems that you have before you. So don't wait for some specific time period. And that we're changing that gradually, and we are getting people to think differently.
Okay, Minister, before Dr. Rose come on, there are also reports of collusion with our pharmacy, the government pharmacy, and private pharmacies, where they're taking the drugs and selling it to private pharmacy. Are you aware of that? And if so, what is the ministry doing to mitigate that problem, if there is a problem there?
Well, again, from time to time, you hear that these things are occurring, but we need people to bring us the information so that we can see and take action. As you know, look, if we find people like this, we are going to jail them. I don't have any qualms about that. I'll call the police in and get the police to go investigate it, and if you find people guilty, they go to jail. Let them go. You would have seen two cases with the vaccination cards. One was a driver in the ministry. We got the information. I called the police in. Police then took action. I think he is right now in prison because of that. Similarly, there was another case of another driver in West Amarara. So once we have actionable information, we'll get the police involved and let the police do their investigation and prosecute who needs to be prosecuted. That's the only way we can stop these things.
But Minister, if I cut you, sorry, I know we're out of time, but you don't have to get a report to do it. A simple audit will do it, because if you have 10 beginning inventory, beginning balance, you get 20 from the bond, that's 30. Your prescriptions say that you give out 5, so I must have 15 in stock. If I don't have 15 in stock, where is the 15? So a simple audit from your ministry or the audit office can help mitigate that problem as well, if that is happening. I'm not saying it's happening, but maybe those controls need to be put in place to ensure that those things don't happen. Minister, now we're running out of time. Dr. Rose, anything for Minister before we close?
Yes, before you go, Minister, I have to ask you about these questions. We discussed it before. The hospitals and the health clinics of Berbice have the quarantine. They are in horrible state. Patients have to wait at least 8 hours before they see a doctor. The toilets do not function. There are the garbage cans in those hospitals. Beds don't have mattresses or sheets or pillows or pillowcases. X-ray machines do not work. Sometimes they're out for 3-4 weeks, a month, 2 months. The dialysis machine in New Amsterdam is inoperable. It's not working. And there's shortages of drugs of all types. What do you intend to do to solve these problems?
Well, that's a long list you give there. So let's start with the last one. Drugs. There isn't any drug shortage. And I can tell you that because at the MMU, we have all the drugs that people need in the system, right? Now, more recently, I even spoke to the regional chairman, and they sent down several trucks to pick up drugs to put in the hospitals in Berbice. So I cannot see how you have drugs that are at the regional bonds and they ain't meet the health centers or whatever. So drugs should not be short in Berbice, right? But again, since we spoke, I have asked to do a check on the various health centers to see whether or not there are peculiar shortages. But I can tell you from a national level, there isn't any shortage of drugs, and there shouldn't be any shortage of drugs anywhere in Berbice. So that's one. Second one, in terms of dialysis, we have about 14 patients who require dialysis in Berbice. We had provided the space, electricity and water and staff for the Dubai Medical Center to operate the dialysis facility at New Amsterdam. This is supposed to be free per pay service, and I think they were charging about $8,000 per session or something like that. But we were able to give the other things like the utilities and so forth so as to help with the cost. The government policy has been that once you require dialysis for the first set of sessions, that we will give you a voucher of 360,000 Guyana dollars as a one-off payment. Most of those patients in Berbice would have received those payments, right? Now, Dubai Medical Center decided that they can no longer operate the center at New Amsterdam, and they have closed it. So because they have closed it, the patients there would have to look at alternatives of where they can access dialysis. Now, we are working with another provider to see whether that provider can go to Berbice and to provide dialysis. But that's what it is. You have a private sector entity that was providing it, decided it's no longer viable for them, and they closed the facility. Now we have to look at an alternative. In terms of health centers and the state of the health centers, I can tell you right now we are implementing a project of more than 90 million Guyana dollars to fix health centers across Region 6. And we have a project to fix Blackbush Polder, the hospital there at Maibikuri. We have just recently given out a contract to be able to fix that hospital because it's in a terrible state. And we wanted to fix some aspects of Port Morant Hospital. And that's something that we are, I think the contract has been given out, but I'll have to follow up to see what's the state and where the contractor is on doing the repairs there. Skeldon Hospital, we had set aside $45 million to do work at that hospital. $45 million is not enough. And the government is taking a decision where we probably would have to pull down that old hospital and to do major rehabilitation and even build a completely new hospital. That's the state of which it's in. We have tried to repair different sections and wards and so forth, but really over time they have built a little piece here and a little piece there that it's not functional. And therefore the time has come where you probably need to put in a new hospital. And that's something that we're working on. I'm hoping that we'll do the designs for that facility in this year's, the money that was allocated this year, and so that we can probably go out next year to tender for a facility that we will build sometime next year. At New Amsterdam, there are some works that we are going to be doing. Again, we have set aside, I think, 120 million Guyana dollars to complete those works. We went out to tender, we didn't get a company, and so we have to go out back again. But that's the state of play with some of the facilities there. But the 19 million Guyana dollars that we have set aside and given contracts to the different persons out there, certainly it would address some of the concerns dealing with waiting area, with sprucing up of the facility, with fixing toilets and those kinds of things.
Minister, we want to thank you so much for your time. We're running out. We have come to the end of program time now. Dr. Rose, we have a lot more questions for you, Minister. You'll have to come back sometime not too far in the future so we can continue the discussion. But Minister, we want to thank you so much for being with us. Anything in closing?
Well, thank you very much for having me. And I hope that every one of the programs that you do, you continue to urge people to get vaccinated, because without that vaccination, our public health system would be severely challenged, because we'll end up with more hospitalization and more deaths. And none of us want to see that. So if you can use the advocacy on your programs to reach out to people and get them, let's try to persuade them to get vaccinated. And I know the diaspora who listen to your program has a lot of influence back home. They can also use that influence to call their families, friends, and to encourage them to get vaccinated.
Thank you.
We will definitely do that, Minister. We will definitely do that in our program. And as we reach out to our viewers at this point in time, we want to encourage you guys, as Minister mentioned, 67% of the population had their first dose, but only 35% had their second dose. We are appealing to you to please turn up and get those vaccines as they're available.
Minister,
Dr. Rose, anything in closing?
It was nice meeting you, and I congratulate you for the work you're doing, and I thank you very much for at least helping the people of Guyana fight this COVID, this dreadful pandemic. Thank you very much, and we'll talk again later. Sure.
And what we have noticed, Minister, is that all these ministers who come on this program, they're looking younger. I don't know what President Ali is doing to you guys, but the more work you get, I guess the younger you look. Maybe your family is taking good care of you. But Minister, we want to wish you the very best again in your ministry. And I know we want to talk about your...
I guess it's because of the light. You're not seeing the ball hairs.
Okay.
And we want to talk about the programs for next year, but I guess we'll